Hello friends, my name is Samruddhi Jadhav and today we are going to discuss about the parental route of administration. So what is parenteral? Parenteral is the word made from per and enteral. That is, per means beyond and enteral means intestinal. So definition of parenteral route is when a drug is given by any route other than oral or rectal, that is through the gut, it is called as parenteral route of administration. Parenteral route is conventionally thought to be given through the injection, as it is directly injected into the tissue fluid or blood. Also, it doesn't cross the internal mucosa. Importance of parenteral route. It is beneficial over oral route. Also, it is useful in the emergency conditions and there is no interference of food as it is not given through the oral or rectal route and it bypasses the liver. There are many types of parenteral route. Those are intravenous, intramuscular, subcutaneous, intradermal, intrathecal, intraperitoneal, and intracardiac. We will discuss this further one by one. There are some advantages of parenteral route, and those are the onset of action for the parenteral route is rapid compared to other routes. Also, with the precise dosage, the effective result can be seen with the parenteral route. In the parenteral route, as it bypasses the gastrointestinal tract, there is unaltered absorption for the parenteral route. It is useful in the emergency. Also, it is beneficial over the other routes of administrations, and as it is bypassing the gastrointestinal tract, or we can say liver, there is more bioavailability for the parenteral route. Also, it is useful to be given to the unaware patients like unconscious patients and uncooperative patients. In the vomiting patients also, these can be administered effectively. With these advantages, there are some disadvantages also. Like for the parenteral route, the preparation should be sterilized and it is much costlier. Also, the technique that is used for parenteral route of administration is invasive and painful. There is risk of infection if the injections, needles, syringes are not sterilized properly. Also, at the site of administration, there can be tissue irritation or allergic reactions. For the parenteral route, there should be proper skill and technique for the administration of the drugs. Also, there should be assistance of healthcare workers, doctors, nurses, etc. So, it cannot be given personally by the patient himself. There are various equipments for the parenteral route and those are shown here. Those are syringes, needles, IV catheters and sets, infusion pumps, safety devices like needle-free system. The pictures of all those equipments have been shown here. So the techniques and procedures for the parenteral route, we are going to discuss them one by one according to the different routes. So intravenous. Intravenous route is injected as a bolus slowly into the superficial veins. And there is immediate effect that can be seen with this intravenous route. The drugs given can be, highly irritant drugs can also be given through the intravenous route. The complications by this route are thrombophlebitis, necrosis, and risk of air embolism. With the smallest dose of this drug, the desired results can be effectively seen, and this is due to the 100% bioavailability by the drugs given intravenously. What is the advantage of this intravenous route? The response that is given by the intravenous route is accurately measurable, like in BP. Also, short acting drugs can be given through this route, like sodium nitroprusside. Why short acting drugs are given? Because as we have said earlier, the immediate effects can be seen through the intravenous route. Now the disadvantage of intravenous. With the advantages that we have discussed, there is also disadvantage of this intravenous route, and that is it is the most risky route for the vital organs. The vital organs like heart, brain, the if the administration is not proper, excess dose is given, or any other complications are seen, then in such cases heart and brain can be damaged, or it can be risky for the vital organs. Now the intramuscular type. Intramuscular route is, as from the name itself we can say, it is given in the large muscles. So what are the larger muscles in human body? Those are deltoid, triceps, gluteus maximus, rectus femoris, etc. Also, in the intramuscular route, less nerves are involved and more vascular is the supply. So, the less nerves involved are useful for the mild irritants that can be given. Also, the more vascular nature of this intramuscular route can be helpful for the aqueous solutions that can be given, and these can work faster in the body. But the drawback of this intramuscular route, cannot be given by the person himself, that is self-injection cannot be given. This intramuscular route should be avoided in the anticoagulant treated patients. As we can see in the diagram, the intramuscular route is given at the angle of 90 degree. So the next type, that is subcutaneous type. In the subcutaneous route, the deposition is inside the loose subcutaneous tissue, as we can see in the diagram, and it is given at the angle of 45 degree angle with the skin. The subcutaneous route is rich in nerve supply and it is poorly vascular. As it is rich in nerve supply, irritants should be avoided by this route, and the poor vascular condition gives it a slower absorption than the intramuscular route. Also, the action by this route is prolonged, that is, the effects can be seen for a longer time. The subcutaneous route should be avoided in the shock patients, as the shock patients are in the vasoconstricted state and therefore they have delayed absorption. There are special forms of subcutaneous route, and those are dermojet, pellet implantation, Cialistic, and biodegradable implants. Intradermal route. Intradermal route is the route where the drugs are injected inside the skin. The vaccines or the injections that are given by this route are BCG vaccine and sensitivity testing. In this intradermal route, there is a complication, that is, it can raise bleb, as we can see in the diagram. So, what are the common medications that can be administered parenterally? So, those are antibiotics, analgesics, vaccines, insulin, chemotherapy drugs, and specialized treatments. The safety measures and the complications of the parenteral route are: With the sterilized condition of the needles, syringes, and other equipments, there should be the proper disposal of those needles, syringes, that is the sharp objects used in this route. The adverse reactions that are faced while performing the drug administration should be monitored. Emergency response to the complications can be seen through this parenteral route like anaphylaxis. So there are some MCQs that are given here. You can go through them. So this is the parenteral route of administration. We have discussed all the types, their techniques and administration route. Also the MCQs are given here. You can go through them. Thank you.